wealth, there is cause for alarm. There's a saying that goes, the true wealth of a man is measured by his health. The true wealth of a man is measured by his health. I was having a conversation off air with the doctor right here in the studio with you, who I'm going to introduce very soon, and we're talking about how you're not really rich in Nigeria. You think you're wealthy, but have one health issue. Either the system will bring you down, or your money will just finish. It is a normal thing. So you're not really wealthy in Nigeria. So today our topic today is an ailment that the Nigerian Orthopedic Association disclosed in 2020 as affecting more than 1.5 million Nigerians annually. I'm talking about arthritis. So today on Health Pulse on 98.3 Mainland FM, I have with me Dr. George Uchendu, a medical doctor and a sport. If there's a permanent cure, so stay with us and we'll be back after the break. Don't go away, don't touch that dial. Welcome back to Health Plus on this beautiful dial 98.3 Mainland FM, the sound of Lagos. My name is Lillian, like I have said, and I said I have a doctor. He is a medical doctor. He's a sports physician, and his name is Dr. George Uchendu. Hello, doctor.
How long did it take you to learn how to pronounce my surname?
Igbo.
Okay.
That's what I call him.
It's great to be on Health Plus. It's great to be with you here in the studio, Lillian.
Thank you very much for joining us, regardless of your tight schedule. All right. So arthritis, it has been linked to many things, right? Oh, my back is paining me. Arthritis again. My leg, man, arthritis again. So we're here to differentiate between the normal. What is actually arthritis?
Okay, so when we talk about arthritis, we're talking about inflammation. The key feature of arthritis, any form of the arthritis, by the time I talk about the types, is that there is inflammation. Well, what is inflammation? Usually your body responds to injury, responds to infection, or responds to anything that is untoward towards it, anything that a foreign body or whatever it is that is not supposed to be at that particular part, or that particular place in that particular time in your body. Your body responds to it by releasing a lot of things to function. Is a body's response just to save your body. So it's like there is an attack to your house, and then you have gatemen, or you have security people that will fight. So that's what inflammation occurs. And
so the first line of defense.
Like a defense mechanism is inflammation. So arthritis involves inflammation around the joints or other structures surrounding the joint. For example, apart from the joint, so your joint there are bones in your joint, but there are also muscles. For example, let's use the knee joint. For example, you have muscles coming from your thighs, muscles coming from your legs, coming up to attach on the knee joint, and all of that is connected together by the tendons, ligaments, what connects the bone to the bone. So arthritis, inflammation of either the joint or any of them. If you put your head in a certain kind of way, or rest your hand, or put your hand in an uncomfortable position, you would have pain. It's your body, the nerves in your body sending messages to say, oh, this position is not right, you need to correct it. So it's quite different. There can be pain in an arthritis, but in your regular pain there may not be inflammation. If you understand what
Can you say that again?
So in arthritis, most times there's usually pain, because in that inflammation process, pain is a major part of it. But in your regular pain, maybe back pain or neck pain, because you've rested your body in a funny kind of way, there would most likely not be an inflammation. Okay,
that's the difference.
Yes.
Regular pain has most times
has no inflammation.
Yeah. Okay, so let us talk about the symptoms of arthritis.
Okay, so swelling now is a major part of inflammation. So when all of that fight is going on in the body or in the joints, there's a tendency that part of the body will be swollen. So that's another symptom. If you notice swellings around your joints, any of your joints, it might be your fingers, it might be your toes, it might be your knees, maybe any joint, anywhere you have joints in your body, if you notice swelling,
and if you don't hit that part of the body,
exactly, if there was no previous hit or trauma or injury to that place, and you just notice, a lot of people will find it very difficult to move that joint properly. Stiffness goes with a reduced range of motion. Usually, if you raise your hand, I guess you're streaming live, so those watching can see me. If you raise your hand up, your hand easily moves.
Okay.
If you do your elbow, it easily moves. But if there is a problem with this joint, you will find it very difficult to move it. The range of motion will be reduced of arthritis, depending on the kind of arthritis the person has.
Okay. This is still Health Spot on 98.3 Million FM, the sound of Lagos, and we are live on Facebook and YouTube. So you can go to our social media channel. That's on Facebook, Mainland 98.3 FM. On YouTube, the same thing, Mainland 98.3 FM. So in the process of watching, you can send your comments, your questions to that particular channel or Facebook to ask the doctor any question that you want to ask him. All right, you can also follow us and subscribe. All right, now I know that there are numerous types of arthritis. Can you highlight some of them?
Okay, yes, there are different types, but for easier understanding, I would like to put them in categories based on the possible causes.
Okay.
Now, the first I will talk about is what we call degenerative arthritis. Degenerative arthritis is what a lot of people have. That is where osteoarthritis comes in. And degenerative arthritis, usually the body is a machine, and just like every other machine, if you don't service it properly, if you continuously use the machine without rest, without treating it right, it will break down. And so degenerative arthritis occurs due to the common wear and tear. So you're constantly in a particular position, you're constantly walking that particular joint, or you're constantly doing something that involves your any part of your joints, and you're not resting, you're not eating well, you are living lifestyle choices are poor. With time, and as one ages, the joints begin to wear and tear. And then what causes the wear and tear majorly is that if you use the knee joint, for example, the knee joint is two fists coming together.
Okay.
Now, a bone from your thigh and the bone from your leg, now they are not supposed to touch each other.
Okay.
They are surrounded by fluids, cartilages, that help it move, exercise its functions, and also more or less just rub all over the surface. So like oil, cartilages, and so to help it move properly. But with wear and tear, those cartilages, those fluids gradually reduce, and then it gets to the point where they begin to rub each other. These cartilages and fluids also help as shock absorbers. So when you jump up and you land, the reason why you land and you will not feel any pain in your knee is because of those things that are steadily bathing. So if those fluids are no longer there, the cartilages is gradually worn out, the bones begin to rub on each other, and then that begins to affect inflammation occurs and begins to affect the quality of movement on that place. So that's the degenerative arthritis due to wear and tear. Occurs with age, and research shows that women are more likely to have osteoarthritis. Men are also implicated, so that we balance. So balance all of that out. So that's degenerative. We also have where we are dealing with an inflammation, which I explained earlier. And inflammation can be due to a previous injury to that joint, an infection to that joint, anything that will cause an inflammation to happen, or cause the body to release. You would have inflammatory arthritis. You can have psoriatic arthritis. You can have the few other arthritis. I just let me not go ahead for everything. But anything that will cause an inflammation due to a foreign body being present, or an infection or something, autoimmune arthritis. Now, the autoimmune arthritis. So your body has been made in a way that arthritis, then the body just begins to fight against itself. And that's where the likes of rheumatoid arthritis comes in, or any predisposing issue just releases those fighters, and it begins to go and damage the joints. Rheumatoid arthritis is a very big example of that. We also have metabolic arthritis, fluids in the body and the likes. There's a particular quantity that's supposed to be in the body. Now, if for any reason the remaining is excreted through urine, is discarded, but for any reason the body can no longer discard the excess, lodge in the joints, and they begin to cause pain and swelling in the joints. And a condition like gouty arthritis is a big example of it, due to an injury in that place, a previous surgery, or maybe sexually transmitted diseases finding its way through the would lead to an infective arthritis. So those are the categories, and in each of these categories there are examples that come under.
Doctor Uchendu, you can send us the message, send us an SMS or WhatsApp message, or you can you can call us, okay? Anything concerning the bones, your body in general, you can send it as an SMS or WhatsApp message to 9136 000410. Now, you said from the symptoms, from the types, we can deduce some causes, right? Yes. But then you said that if there's a foreign body, what kind of foreign body can cause one to have arthritis? What can I be doing that can predispose me to having arthritis? I think you should mix in the risk factors there as well. Okay, so let me start with, let me take the causes as there is no one, but there are risk factors that can increase your chances of coming down with arthritis. First, let's start with age. Usually, especially if you remember what I said about degenerative arthritis, wear and tear, as one ages, it's more work being put on. That doesn't mean that younger people cannot, but especially for osteoarthritis, you have more older people coming down with it. You also have gender. I said earlier. I'm not happy with that one actually.
I'll balance it out.
Yeah, regardless.
So rheumatoid arthritis is common in men. How does that sound?
Why is it common in men?
Being a man increases your risk.
Can you remind us what that rheumatoid arthritis?
Rheumatoid arthritis is under autoimmune arthritis, where the body without any previous trigger just begins to attack.
So there's scales inside and outside the man. It's fine. Okay, continue.
So osteoarthritis common in women, rheumatoid arthritis common in men.
Okay.
Yes.
Okay, so balanced now. Fine.
Balanced. So that's gender. Now, lifestyle can be a risk factor that can increase.
What kind?
Smoking, excessive drinking, and not eating a balanced diet, not eating more processed foods and added sugar, and can increase risk of arthritis. We also have obesity.
Okay.
That's another one is on the big side, or obese. Let me say obese, medically obese. There is so much pressure that is put, for example, on the knee joints.
Okay.
There is increased pressure, and that increased pressure causes increased wear and tear.
Okay.
And then can increase the predisposition to arthritis. And finally is family history. So also I try to have genetic predisposition. So if there is a family history, someone in the family that has osteoarthritis or has rheumatoid arthritis or the likes, is a possibility that you can order one or two other people in the family. So
if it's someone in the family that has that, you just be careful.
You need to.
Whatever I do, regardless of whatever I do, I might get it, or I can prevent it.
So what people need to understand with the genetic predisposition or family history of any diseases. So I will use both of us as example. Let me use arthritis. That's what we're talking about. If my chances of having arthritis when I do all this, we talk about risk factors and poor lifestyle and the likes, all these other risk factors.
Yes.
If with all of that joined together, my chances of having arthritis without a family history is 30%.
Okay.
Yours will be times 2 or times 3. But if you don't pay attention to it, your chances are more, because there's already a family history, there's already a genetic line to it.
Well, you know what you just said. Let me So in one of them, because whenever I see them, I also research to make sure that everybody in the family, even the men in the family, had breast cancer. Okay. So she went to cut off hers. You're saying that there's there's no way she can actually prevent it.
Went to the hospital and they tested her.
Yes.
And checked the levels.
Okay.
And then said, okay, yes, there's a family history, but we've checked you and we've seen that it's still very, very minimal. So we can begin to attack it from when it's very minimal and
It's dangerous.
It's dangerous. Then we need to
do something about
so it's the same. It's the same
Okay.
thing.
All right, let's move back to arthritis now.
Yeah.
You're talking about the risk factors.
Yeah, talk about risk factors.
Okay. Right. It's 98.3 Milan FM, the sound of the Lagos. Any question you have for the doctor, like the good doctor, you can send that to 09136000410. You can call that same number. Now let's talk about treatment.
Okay.
Many issues, many illnesses in Nigeria and the world don't have treatment. They only have management. Is that the same for
Conditions that may not necessarily have cure, but with arthritis, there is so to debunk a myth that arthritis does not have a cure is a lie.
it has a cure?
So the cure is dependent on the cause. So you tackle the cause, and then
You can
let's look at it. We have osteoarthritis. Let's start with osteoarthritis, for example. The cause of osteoarthritis is a constant wear and tear. Now, depending on the level of the wear and tear, you can talk about giving certain kind of drugs to reduce the wear and tear, or to do as much as the surgery to put something that would stop the bones from touching each other.
Okay.
If you talk about infective arthritis, as a result of an infection, what you need to do is to treat the infection. You do one test to know the particular infection that is in the body causing that arthritis, and then treat that infection. The moment you treat that infection, triggers also releasing things to fight against itself. If you give drugs that would reverse that or stop that, the arthritis is gone. With gout, I talked about gout is uric acid, increased uric acid. If you give drugs
To balance it out?
the arthritis is gone. So a lot of this arthritis, they have cure. The cure is tackle the cause, and then the arthritis is gone. Now the only one that you say that is more or less
It's when
even without anything, as you age, just like as one ages, the heart gets weaker, because the
whole body
literally gets weaker. So for people who don't have any other causes to do, is to manage if there are pains, you manage the pains. If there is swelling or anything causing, you just manage it.
Okay, and they should not be on their feet for so long.
Exactly, and they shouldn't be on their feet for so long. You should rest, you should eat properly, take lots of water, while taking any other thing that the doctor might have given them to help with whatever it is.
On that, you said that osteoarthritis is when whatever is cushioning both joints,
yes.
when they decrease, and do the bones shrink? Or is it that just the fluid reduces and then start touching and
is not the bone shrinking, is not the bone increasing. No, the bones, they get to a particular zone, and then what that means is that the bones now begin to. So if you look at it from the way you're looking at it, if the bones begin to touch each other, clearly it may now look like they will be it will affect movement. In terms of, you will notice that it looks like the person is moving a certain kind of way, or limping, if you put it that way. But I get what
you talked about the cures, and you talked about how you have to tackle each symptom, each cause individually, right? Now let's start debunking some myths on arthritis, and but from what you've said, you've actually debunked a couple of them,
especially the gender.
Yes. The gender and the
arthritis that affects children.
Wow.
Juvenile idiopathic arthritis can affect children. So it's also under autoimmune arthritis, where the body in a child, the body just releases, without any trigger, just releases fighters, and just start fighting, antibodies start fighting.
The reason you have this joint ache is because you have arthritis. You must say, no, now it's not for us. I'm still 30 something.
So there are people who sit for long hours, there are people who stand for long hours, there are people who do something that repeatedly puts their joints under pressure and work. They can have increased chances, and that doesn't depend on age, really.
Okay, and then there's a myth that says you lose just a few pounds, your OA, that's your osteoarthritis, can actually reduce. Is that?
Yes, that's true. Remember, I talked about obesity as a risk factor. So, and I said that with obesity, with increase weight, you put a lot of pressure on those joints of your body, especially joints from your waist going down. The pressure falls on it. So key factor will be losing some pounds, losing some kg, maybe exercise and the likes to reduce that pressure, so that the wear and tear is also reduced. So yes.
Alright.
Yes,
before we continue tackling some myths, let me read out a message that, please doctor, what is the cause of the right leg and hand getting hot?
Hot, like H-O-T,
like
or H-U-T?
H-O-T. The person actually said hotten. I don't know.
Hotten.
Like H-O-T-T-I-N-G. What is the cause of the right leg and hand hotting?
I might not understand what that fully means, but let me try and
take hot and take hurt.
Okay, let me paraphrase it. Now, if for some reason one part of your body, the way it described it feels like maybe one part of your body is hurting or hurt, there's something wrong with one part of your body. In this part of the world, a very, very common is stroke, possible stroke, and we know stroke comes from high BP and the like. So there's typically you can feel weak, and maybe because you've done something with your hand, your hand can feel. But if for any reason you feel that one part of your body from your right hand going to your leg is feeling a certain kind of way, that's not a good sign. And as I said, in this part of the world, it might be a sign of stroke or even a stroke happening. And so if you're feeling that way, I'd advise that you go to the hospital and get checked.
Go to the hospital and get checked. Do not sit on that. Alright, and it's 98.3 Milan FM, the sound of Lagos. Keep your questions coming in. 09136000410. We're going to take a breather. We'll be right back. Stay tuned. Almost everybody has or will encounter with time, especially as they age. Okay, and I have with me Dr. Uchendu. He's a medical doctor and a sports physician. Am I pronouncing your name well?
I'm
really emphasizing.
Why you choose Dr. Uchendu instead of Dr. George?
Which is your surname?
Uchendu is my surname.
Dr. Uchendu.
Okay.
Well, I'll call you George.
I'm just not used to Dr. Uchendu. Nice.
Well, you gotta get used to it, bruv. So we've covered what arthritis is, the types, symptoms, causes, treatments, and risk factors. We've started debunking some myths and proving it, or proving them, or adding facts instead. So if you have any questions, you can send them to 09136000410. I had a question of my own, but there's no way I'll allow you to hear that. Okay. There's somebody who called some time ago on Health Bus where I was talking to a general doctor. I don't know whether you would be able to answer this question. He said that whenever he wakes up in the morning and just comes down like from his bed, obviously from where he said it, he has a high bed. So he comes down. It's not like anybody that climbs up from there. So he comes down from his bed and he has a shock on his leg, like a literal shock on his leg the moment his leg touches the ground. What causes that?
He comes down from his bed. Now, when he comes down, does he jump down from his bed?
He wakes, like what he said was that when he wakes up in the morning, he comes down and then he gets a shock, like shock on his leg in.
That's not normal.
So what can cause that?
So it might be something that usually when those kind of shocks happen, it's one of two things. It's one, if there are people who sleep and for some reason they don't turn around, maybe so their body is in a particular position all through, and just like any other time, if you put your body in a certain position for long, if you notice, you begin to feel something, you begin to
pins and needles or tingling.
Yes, exactly. And when you try to change it, you might feel that shock. So one, if his body has maintained that position for quite a while, when he tries to change it, he could feel that shock. Second is if there is something affecting the nerves, the nerves of that part of his body, then it might also resort to shock. But there is only one way you can find out, and that is
go and get checked. Go and get checked. Moving back to the myths, we've debunked some said that you can prevent OA, and I think that is true, isn't it?
Yes, you can't really.
Not
everybody would have it, but you can minimize.
Yes, but you can. If it's going to reduce, it's going to reduce. It's not like when you're drinking it, exactly. It goes straight.
So the 70-year-old, 80-year-old person, you notice they don't walk as gingerly as we young people would walk, and that's because a lot of those cartilages or fluids are gradually reducing or wearing out because of age. So for that, you pretty much can prevent it.
Okay. The more you use your joints, the more they hurt. I think this is linked to OS too. OA, I beg your pardon.
The more you
use your joints, the more they hurt.
But you know you're using your joints now.
I know.
Do they hurt?
Maybe later when the fluids disappear.
So what I can say is the explanation to that is the more you keep your joints in a particular way or do things that would
make it.
So there are people who stand for long because of their job, or there are people who maybe hairdressers or
medical doctors,
surgeons, so people who stand. If anything you do that increases the use of your joints, if you don't rest, if you don't relax, if you don't do all the other things you need to do, then yes, there will be an increased chance that you can come down with pain on the long run.
What about cracking your knuckles? I've heard this thing over and over again. I've heard it over and over again. That it causes arthritis. So what are you doing? You're cracking your knuckles to prove to me that it doesn't. They say they can also cause crow's fingers. You know, crow's fingers.
Wow. I've been cracking my knuckles for over many years, and
so it's not a problem.
That's not true. That's that's so far from the truth.
So it's just something of manners.
Has nothing.
Some people don't like it, so just because they don't like it, they have to put a meat to it.
In our parents, you usually put meat to somebody. If you cross somebody, if you cross them, because they want us to avoid something.
Alright, let's go back to this message. So this young man who asked about the hotting, he added it again, so I think it's HOT now.
Okay.
He said, please doctor, what is the solution to that hotness of my body? My doctor said it is not stroke. So why will his right hand and leg be hot?
Okay, I mean, I'm glad that he's ruled out
stroke.
So another thing that can cause a part of the body having a different temperature from another part of the body is what we call endocrine disorders. Now, endocrine disorders, I'm not sure. I mean, it can be.
Yes.
And so that he doesn't take it and say,
so this is
ultimately he needs to get to the hospital. And then
since I've ruled out stroke, he has to now find out.
What is
that one to
for example, there are people who, especially women, you notice that have swellings.
Okay.
In their neck. Now, I've forgotten. I don't know why the name escapes my head. What that is called, but it's under endocrine disorders where some hormones that are supposed to be released are not released, or some substances that are supposed to be released in the body are not released, and part of what those hormones or fluids do is to balance temperature, is to help metabolism of the body happen as it should happen. So if those hormones or those substances or those fluids are not released by the body, there might be changes in temperature. There might be a situation where we are here, the temperature here is pretty cool, and then someone is here and is saying it is really hot.
Oh, okay.
But we are cool, we're not hot, but you are hot, or we are very cold, or we are very hot, we're sweating, and the person is not feeling.
You're just getting a different temperature.
It might be that, but as I said, ultimately, it's not normal. First and foremost, that's not normal that your left part of your body or your right part of your body would feel different from the
other parts. It's not, so he has to go to the hospital to find out why that is happening. Okay, thank you very much for joining us today, Doc, on Health Plus on 98.3 Milan FM, the sound of Lagos. Please don't be a stranger. We've had, in case you don't know, we've had Dr. George Uchendu, a medical doctor and a sports physician, okay, and he has helped us to understand what arthritis is in its entirety, the causes, the risk factors, symptoms, and also he has told us that there is a cure for most of the arthritis.
Yes.
All right, so always do things that will make you healthier and not degenerate your body, okay? Your exercise. Any other tips?
For those who are obese, you need to cut down weight, you need to eat healthy, eat right, avoid smoking, cut down on alcohol, and then if there is, for family history, you need to ask questions.
Okay.
If you find out that there is a family history, then you need to just go to the hospital, get checked, so that it can begin to be managed.
A lot of people are looking at, whenever they want to get married, they start looking for history of madness in the family, and that's it. And
they don't look for the similar things.
And that's it. But the other ones that are very life-threatening, they don't look at it. So it's not really madness and history of madness and elephantiasis and other kinds that you guys go to look for when you want to get married. Look for other things as well.
Exactly.
All right. So my name is Lillian Abarika. Thank you very much for joining us today on Health Plus. And every Friday we're here 10:15 a.m. So stay tuned. Still on the matter with Tony Thames and Alexandra up next.